Our guest presenter today is Claire Levin, a senior consultant with Research Power Incorporated, a health research and evaluation consulting firm based in Nova Scotia, Canada. Welcome, Claire.
Thank you very much. And hello, everybody who is on the line today. I'm very pleased to be here to be able to share a little bit with you on some of our work around the Workplace Health and Safety Action Plan that we've been doing. So Kevin already spoke a little bit about me. So I'm a senior consultant, as he said, with a consulting company based in Halifax. We're called Research Power Incorporated. And just to give you a little bit more of a background in terms of the company and the work that we do, we are based in Halifax, which is on the east coast of Canada, for anybody who's not familiar, but we do work with clients from across the country as well as locally and provincially. And this work on the action plan that we've been doing is one of our key areas of focus around strategic and action planning, but we also do a lot of other work related to program and policy development, a lot of work in evaluation, research and environmental scans, facilitation and consultations, and project management. And we do focus primarily on the healthcare sector, but we do work in other areas as well. So we've done some work in education, justice, early childhood development, environment, so a whole range of different topic areas. And the website is there if anybody is interested in learning a little bit more about us and the work that we do. So talking more specifically, of course, about the Workplace Safety Action Plan, which is what you're all here to learn more about. So this is a project that we've been involved with for about a year, and our role has been project management as well as support with various pieces of developing the action plan, so the research side of things, as well as consultation and analysis, facilitation of meetings. So it's a kind of a multi-component project in terms of our role, and we're about 3/4 of the way through in terms of the project overall, and I'll talk a little bit more about exactly where we are in a few slides. But just to speak about the kind of the rationale around developing a workplace health and safety action plan, and this action plan really focused on the health and community services sector here in Nova Scotia. So this is a sector that, you know, it's the biggest industry sector that we have in our province, but there is quite a high rate of work-related injury and illness. And this is something that you'll see in, you know, in other provinces in Canada certainly as well, and I imagine elsewhere in the US and other countries as well, that there is a high rate of injury and illness. And here in Nova Scotia in particular, the trend is not what we want to see. The trend is actually going upwards in terms of that rate of injury and illness. So that's really kind of where the motivation for developing an action plan around workplace health and safety, in particular for healthcare and community services, came from, because obviously there's many negative consequences of that. This is something that people don't always realize if they're not in the healthcare industry, and even those that are in healthcare and community services don't necessarily realize, you know, people don't think of it as traditionally a sector where there are a high rate of injuries. When people think of dangerous sectors, they usually think of things like mining, you know, fishing perhaps. So it is something that people don't necessarily know that's an issue, but it is a common issue. So the goal really of our work is to develop a 5-year action plan, and within health and community services we're looking particularly at the home care, home support, so that would be going into people's homes and providing either nursing or other kind of personal care or personal support services. Within long-term care, that's things like nursing homes, residential care facilities for seniors. I'm just throwing out a couple of examples because I know the language is not the same for everybody. And then community services, this is mostly related to providing supports for individuals with disabilities. So things like, you know, group homes or small options homes, larger residential facilities for individuals with disabilities, be they mental or physical disabilities, as well as other types of services like social enterprise, that kind of thing for that group. So those are really the three sectors that we've focused on. So you'll hear me refer to them throughout the presentation as home care, long-term care, and community services. And the group that's been involved in the project is a multi-stakeholder group. So we are working with the Workers' Compensation Board here in the province, several government departments that address these sectors, in the Industry Safety Association here called Aware Nova Scotia, with organized labor, so unions, with employers, both large and small employers, and of course with workers. They've been involved in that in the process as well. So definitely a multi-stakeholder approach. So I just wanted to give you a little bit of a bird's eye view in terms of where we are with the work. So in the first phase, which is those orange colored boxes that you'll see on the screen, we started by conducting some research around workplace health and safety in these sectors. So we did an environmental scan and a jurisdictional review looking at, data and stats on injury rates, what are the types of injuries, what are the common challenges and barriers to addressing injuries and causes of illnesses in the workplace, and looking at, best and promising practices. So that was really about looking at the research, and I'm not going to touch on that in terms of the rest of my presentation and what we did with NVivo. And then we did a consultation phase, and that's really where I'm going to be focusing around talking about how we used NVivo to help support the consultation process. So I'll talk a little bit more about the consultation and the methods in a minute, but it was a wide consultation with all the three sectors of interest and stakeholders at multiple levels. So then, of course, we completed the analysis, looking at both the research and the consultations, and we're now into sort of a second phase of analysis where we're working with 5 working groups that are addressing specific topic areas within work health and safety, and we identified those 5 topics through the previous research and consultation processes that happened. So we're working with those working groups to actually now develop what are the actions. So it's a very much, again, a kind of a multi-stakeholder participatory process to help support that action planning piece. So what are the key actions that are going to be recommended to go forward in the action plan? Once we have a draft action plan, so the blue consultation box will be kind of taking that out back to stakeholders and saying, okay, here's what we ended up with. Does this make sense to you? Are there any gaps? Anything else we should consider? What do we need to, implement these actions? What supports are needed? So that's what that second consultation piece is about. And then, of course, there's going to be some analysis and review of that validation information, and all of that will contribute to the final action plan, which should be completed sometime probably this fall, or maybe winter, before it's sort of all gone through the appropriate channels for approval and everything like that. So that's where we are in the process, and so I won't be sharing, specific actions or, particular findings or anything like that today for the action plan overall. I'm going to speak to how I used NVivo around the consultation piece that we've already completed. So moving a little bit more into the consultation. So this, in the phase 1 consultations, which is what I'm going to focus on, we really used 3 methods, and this is, again, just to give you some of that kind of context and background to help inform the analysis piece that I'm going to talk about. So we did large group sessions with anywhere from, some were as small as only 5 or 6, upwards of 30 to 40 people, with both frontline workers and managers and supervisors in the 3 sectors of interest. The large sessions had mixed participation from the different sectors, but we did separate the sessions for the frontline workers and the managers, supervisors, just so the frontline workers would feel comfortable, to share information, and managers and supervisors without having their other level colleagues there in the room. And when I say frontline workers, I'm talking about, the direct care providers, so that might be nurses, home support workers, continuing care assistants. Again, there might be some different language in other jurisdictions, but also, housekeeping staff, maintenance, dietary staff. So really kind of the whole range of employees that might be working in these different settings. Then we also did focus groups. So these tended to be a little bit smaller, kind of 10 to 15 participants, and they focused primarily on sector leadership. So we plugged into existing forums where leaders were coming together already. So whether that was facility administrators or, other leaders of organizations delivering these services, and, took an hour out of their kind of agenda to do a little focus group with those folks. And we also use the focus groups for some other kind of targeted key stakeholders. So for example, staff that work for our Department of Labor and Advanced Education in conducting safety inspections of these facilities as another example. So those labor department staff that would be involved in that. And then the third method that we used were 2 online surveys. So one survey was open to any stakeholder that worked in or supported organizations in the 3 sectors of interest. So again, that could be leaders, managers, supervisors, employees at all levels. And then we did a second survey with family and friend caregivers. So these would be the family, the friends that are caring for a patient, client, or resident who might be, receiving home care services. They might be in a long-term care facility, or maybe they're a community services client with a disability. So that was the second piece. And around the outputs, and again, when I move over to NVivo, I'll get a little bit more into detail around this. Around themed positive and negative factors. So I'm going to talk about that in a minute, but we did have session notes, and we had some themes from each of the large sessions and each of the focus groups. The online surveys were in a different format, so we had an Excel file with the survey responses. So a little bit of a different format for those 2 types of consultation methods. So then the key questions that we used across all 3 methods, 4 that are up on the screen, although we did, they were adapted a little bit for each audience. So what are the positive factors that influence worker health and safety? What are the negative factors? So really just wanting with those 2 questions to get a good understanding of here in Nova Scotia, what are the issues, what are the factors that either contribute to or create barriers for health and safety in the workplace. And those were essentially the same across all 3 methods that we used. And then for questions 3 and 4 in the focus groups and in the large group consultation sessions, we looked at those sort of separately. So what are the opportunities, and then what supports are needed to take advantage of the opportunities? And but in the survey, the question was a little bit more general. So we really just asked what is needed to make workplaces safer. So we didn't have that kind of differentiation between opportunities and supports. So I want to just also share a little bit about what we did with the large sessions and the focus groups around the positive and negative factors. I want to talk about the technique that we used in the sessions, because that is related to how we did the analysis and how we used NVivo. So what we did in those sessions is we had people, especially if it was a larger group, they broke into small groups by sector. So any participants from the home care setting, they went together in a small group. From long-term care, they were together in a small group, and community services. And then we had them discuss these questions. So first, what are the positive factors? And then what are the negative factors? And each group wrote their positive and negative factors that they identified. They wrote them on a sticky note, like on a Post-it. So at the end of the small group work, all the Post-its then get on a main wall so that everybody can see them. And then the facilitator worked with the group members to help theme those positive and negative factors. So it's really, I think it's really important to understand that the participants were very closely involved in identifying, well, what are the themes and how do we group these different positive and negative factors together. So the output from the session is, we had some detailed notes around the discussion, but then we also had these post-it notes that were, the theme was named by the group, and then we had all the kind of supporting the sub elements that were reflected on the post-its to show, what were the different pieces that made up that theme. So I'm going to just switch over to NVivo to show you a little bit more about how we used some of NVivo to support our analysis. So I'm going to talk specifically about auto-coding, thematic analysis. That's obviously a general analysis approach, which is what we did, but I'll talk about how we use NVivo for that. Matrix coding queries, and then word frequency queries is what I'm planning to touch on. Oops, sorry. Let's go right here to NVivo. Okay, great. So I just want to start by showing you the overall theme. So you see I have one. The subnodes underneath are actually the main headings. Heading are different. So what we found is that the same themes were coming up under both positive and negative factors. So that's why it's very, the main headings are similar. And I'm going to talk about how we created these with auto-coding in just a minute. But again, to look at the opportunities and supports, what we ended up doing was combining the opportunities and supports together. So even though we had asked them as separate questions in the large group sessions and the focus groups, we didn't ask it as a separate question in the survey, and we also found that in some sessions people talked about something as an opportunity, in other sessions they talked about it as a support, and there really wasn't a significant difference in where something was included. So ultimately we ended up combining those together. So just if you're wondering where that all went, that's what happened. So I'm going to go back to my sources for a minute just to show you an example of how we created some of these. So these are from, I'm just going to open this first one, and I'll just mention too, of course, that just for confidentiality reasons, we have removed identifying information from if you're wondering why it just says employees one, etc., that's why. It's just the identifying information has been removed. So you can see that what we did to make our lives easier and to take advantage of the auto-coding feature of NVivo was we set up our note template to use a heading structure. So positive factors, that's a heading level 1, and then all of these sub headings are heading level 2, and these are the things that these are the themes that the groups develop themselves. So the individual bullet points under each subheading, those are the individual factors that would have been written on the sticky notes by the groups, and then they're grouped according to the broader themes that the participants developed. So just looking at this one as an example, so these are the positive factors, and then the sub themes under positive factors: culture, safety management systems, training, policy, model of care, work environment. And then we come to negative factors. We have staffing, policy, work environment, culture, communication, equipment, education, training, client resident behavior, and facility. And then the opportunities by the group, but they did discuss the opportunities and supports. So NVivo has a handy coding that will allow you to quickly show you what I mean. You can auto-code using the source structure or style. You put your headings in, and then essentially NVivo creates the nodes basically to see all the themes that had been identified by participants at once, and to combine and organize the information very quickly. So for example, across the different sessions, people use different language. So, some groups might have said safety management systems, some groups might have said SMS, which is the short acronym for it. Some people might have said training, some might have said education. So there were some language issues, so that it was very easy to look at, okay, what is the list of themes under positive factors that's been created? And then, combine and group them together. So once they were auto-coded, that's what we did. And then we also reviewed, obviously, once the kind of main themes were created, we reviewed within each of those main themes to make sure that the content was similar. So we went through each of these individual bullets that were included under each theme and just, in some cases, themed it under a subcategory of that theme, or in other cases we may have moved it. Maybe, we said, okay, well, this group has put, something around funding in the policy theme, but actually there's a separate theme that's developed for funding, so I'm going to put it over there. So NVivo makes it very easy to move things around and to recategorize or recode things. So that process was relatively easy and painless, which was great. So that's essentially the auto coding. We did also use the auto coding feature around the survey responses. So it may just, I'll just show you the survey, how it looks. So we imported it in two different sets, which is why there's two files. So this is the survey results. And really there were three. So what makes your workplace safe? What makes your workplace unsafe? So those would be the positive factors, the negative factors, and then what could you do to make your workplace safer? So that relates to the opportunities and supports. So those are really the only three codable survey questions. The rest of the survey questions are all essentially all respondents. So supervisor, what part of the province, all of that type of demographic information is in there as well. And we did use, with NVivo, you can link each survey respondent with its various attributes and then use those attributes to complete some analysis. So I'll talk a little bit more about that later on when I get into the matrix coding queries a little bit more. But we did that as well. And I'll just point out too that I'm using NVivo 10, and I think in NVivo 11 that whole process is essentially automated, of having to kind of associate the demographic characteristics of each survey respondent with their responses, so that you can do that analysis later. Okay, great. So then the survey findings, obviously these questions we had to code manually. We already had our main themes in each area, so we just, we use those as the main structure, and obviously we added, in terms of thematic analysis, we added to the subgroups as we went. So, under clients, these are negative factors, so these are some of the things that came up, right? Client attitudes, challenging behavior, family caregivers, acuity, complexity, and care needs of the client. So those are some of the negative factors that came up under clients, just to show you an example of some of the types of things that people talked about. We did not code the detailed notes that we took during the focus group and large group sessions. We just used those for context or to provide additional detail. So when we were doing the analysis and writing up, we used the themes and the factors, the kind of bulleted list of factors from the post-it notes as the main foundation for that, and then we drew from the detailed notes from the sessions as as required to add additional depth, context, etc. Okay. Then the other thing I'll just mention is that there is I talked already about using applying demographic information to the survey respondents. So in terms of what kind of employee they are, what sector they work in. But with the large group consultation sessions and focus groups, we could have developed a source classification, is what it's called within NVivo, but because there were different sectors identified within each document, that wouldn't have worked very well. So that would have worked for identified employee sessions versus manager, supervisor versus a leadership session, for example, but it would not have worked for these sub-bullets, because if you see here, DCS, so that refers to community services. So this identifying a culture of violence as a positive factor, that came from the group at this session that was from community services. The other ones, LTC, those are from long-term care, and then you see here's one, HC at the end, with from home care. So we wanted to actually be able to theme each or code each bullet according to its sector. So we had to do that manually. So we just had a node that we created for the 3 sectors and coded accordingly just by, the same way you code anything, selecting and dropping it over. The respondent type, that was just around the employee, leaders, managers, and others. And for those, we'll source, because that's how the groups were organized. Okay. So I want to talk a little bit about the nodes to look at, and the references. And each of these, NVivo has an option, it's called aggregate coding from child nodes. So within the sub-nodes of accountability, so this includes all the different sources that have been identified in the sub-nodes and all the different references. So it's a total of 153 references. And then obviously the various, some were kind of just general accountability comments, and others went to these specific sub-themes. So you can look at that as an indication of strength of response, but it's a little bit tricky because of the different types of data sources that we're using. So if we're only looking at the focus groups and the consultation sessions, where there's one source with a set of notes for each session, then looking at the number of sources gives you a clearer picture of what the strength of response is of that particular theme. But because we have the survey in there, that's only counted as one source. So that sort of changes the picture of things. And then with the references, obviously it's counting multiple references from the survey. Primarily we had about 800 respondents to the survey. So yeah, that affects the numbers quite a bit. So we used matrix coding queries to start to look at some of this. So I'll go into my queries. And again, I have these are all queries that have been set up already, but I'll just show you how let's look at negative factors first. So this is the way we set up the matrix coding queries. So that's just the name of it. So then in this particular query is looking at the negative factors by setting. So all of my high-level themes from negative factors are included in here, and we also created some queries which aren't in this kind of cleaned up version of the file to look at all the sub-themes under each of the main headings. But so those are all there. And then under columns, we wanted to look at this by setting. So this is where we used the attribute feature to identify, we wanted to look at all the survey respondents where they indicated yes, they worked in home care. So that's going to be one of the columns. All those who said yes, they work in long-term care, residential care facility, which is another aspect of long-term care, small options group home, that would be community services, and adult residential center, regional rehabilitation center, that's community services as well. So that's what the survey, and that's just the way the question was structured with those different categories. And then within the large group sessions and focus groups, we just had the three sectors that we looked at. So community services, home care, and long-term care. So they're in there separately because of the separate way that they were categorized and the separate type of data source that it is. So I'm just going to run the query, and it'll take a minute to build the table because there's a lot of data for it to review. But essentially, we use this to look at the strength of response in different ways. So we wanted to look at it by setting. You'll see if you look at my list of queries there that we also looked at it by respondent type. So wanting to look at were there any differences between the frontline employees and the managers, supervisors, and then that leadership level. The number of other stakeholders was quite small, so we didn't really look at that too closely. So this is almost finished here. Takes a little while to run, and then I'll just open it up when it's finished. All right. So so here is the results, and what this shows you, the number in this box is, so this is survey respondents, I think that said yes to home care. Let me just make this, oops, a little bigger. There we go. So this column is all the people that are in the home care sector from the survey, and so 36 of them identified accountability in various forms as a negative factor, 25 clients, 11 communication, etc. So you can see, obviously, work environment, factors related to the work environment is one of the biggest areas that came up for people in the home care setting in the survey. So that would be issues such as feeling not having enough time to work safely, having to deal with, say clutter in the home care environment, or people smoking, for example. So those would be all the types of things that might have come up under work environment. So that's for the survey respondents. And then if you look over here, this is from the large group sessions and the focus groups, those who were from home care. So again, you can see work environment had the greatest number of references. So you can see that is consistent in terms of a theme that's coming up a lot from those working in the home care sector. But obviously the numbers here are quite a bit different. So we had over 200 individuals participating in the large group sessions and the focus groups, but we're not capturing the feedback based on the individuals. It's based on the session and obviously the number of times something was written on a sticky in a session. But there could have been 40 people in a session and you only have something written down once on a sticky note. So it's a little bit different in assessing the strength of response from the survey. So what we did to help us look at that was to look at kind of the proportion of sessions and the proportion of survey responses in which the themes were mentioned. So for each of the positive and negative factors, the opportunities and supports, looking at it both by setting, as this matrix coding query does, as well as by respondent type, we then brought this information into Microsoft Excel and just used it to do some calculations based on what the total number of sessions that we were looking at. So the other thing that we did in terms of a different way of looking at this, is you do have also the option to, so this is under View Node Matrix. So right now it's showing me the number of references, but for the large group sessions and the focus groups, we wanted really to look at the sources. So I'm just going to say all classifications, and then it's going to tell me the number. So for the survey, the number is not going to ever be more than 2 because I only had 2 files with survey information in them, even though there were 800 responses across those 2 files. But for these 3, which are from the focus groups and the large group consultations, it's going to give me the number of sessions in each of these mentioned. So again, just the example of home care, you see work environment, that came up very consistently. 9 of the 12 sessions, so we did a total of 12. And so, that gives you, okay, 75% of the sessions, people talked about this issue of work environment, and with the survey responses, you can look at the same number, the same type of proportion. So out of the total number of survey respondents in home care, how many people mentioned work environment as a negative factor. So even though you're not really supposed to quantify qualitative findings, and we certainly didn't put any of the numbers or percentages in the report because feel that that's appropriate when you're talking about qualitative findings, but we did use it for our own analysis and guideline around how to talk about some of these findings. So just to give you a couple of examples, they're not necessarily reflected in this particular as a positive factor. Programs and supports for staff like employee assistance programs, wellness programs, exercise facilities, things like that. That was mentioned more frequently among managers, supervisors, and leaders than it was among employees. So, things like looking at differences like that can help provide some of the nuance around what issues are of most importance to the different stakeholder groups, and that really contributes to a better understanding of what the barriers and challenges are overall around workplace health and safety in these sectors, and what actions might be needed to address some of those barriers and challenges. So the last thing I just wanted to talk about was around word frequency queries and word clouds. So we did this using only the survey data because survey respondents were obviously typing their own responses, it was in their own words. We wanted to look only at that rather than looking at the focus groups and large group sessions where it was a little bit more, it was a little bit more of a facilitated conversation. The facilitator might have been supporting the group around what exactly they wrote down on the post-it or how to frame something that they brought up as an issue or a factor. So we limited this only to the survey responses. So again, I'll just show you. Just indicates the 2 survey files. And I should clarify that this is the stakeholder. I talked about the family and friend caregiver survey, but I haven't included that here in this analysis. This is just the stakeholder survey of all those working in or supporting the sector. So it doesn't include the family and friend caregiver piece. That's separate, and it's not covered in this analysis because there were some different issues and factors that we were looking at. So I haven't included it here. But anyway, so those are the 2 files with the 800 survey responses. And then I was looking for the 25 most frequent words. I have it set to include all the stemmed words and a minimum word length of 4. And that'll just take a minute to run. And these are, word clouds are certainly help you identify some of the themes, and they're just a nice visual to add in terms of the analysis. So you can see obviously staff and clients are both huge things that came up quite frequently. And I'll just flip over here. And I'll mention too that I've already edited this list somewhat. So sometimes words, when we first run the query, a word might come up where you say, okay, well, that doesn't really make sense in this context, or I don't want to include that. And then I would just right-click and add it to the stop words list so that it wouldn't be reflected into the query. So then you can use research to generate a very clients, and there's some, different forms, and then you can export it, and we included those in the reports for both the positive and the negative factors. And interestingly, the positive factors had staff at the center as well. And I mean, really that makes sense because you're talking about workplace, how that comes up the most frequently. And then you can also, look at, through the cluster analysis, you can look at how words are grouped and how strongly things are coming out as well. And this can help you identify different themes and different factors. So sorry, that was for the positive. And then the negative can give you a sense of that as well. In terms of what I wanted to speak to, I'll just flip back here to see if there's an address is there on the slide. Certainly have from anybody who's interested in further information. Thanks very much.